we will discuss about depression. According to World Health Organization, depression is a common illness worldwide, with more than 300 million people affected. At its worst, depression can lead to suicide. Close to 80 lakhs people die due to suicide every year. And suicide is the second leading cause of death in 15 to 29 years old. In 2017, World Health Organization mottos Depression, let's talk. Now, what is depression? Actually, depression is disturbance in sleep and appetite, as well as deficit in cognition and energy. Depression is characterized by prolonged sadness, irritability, and anxiety, lack of interest in normal activities, and major change in sleeping and eating behavior. And difficulty in concentrating, feeling of guilt, aches and pain that have no physical explanation, and at last, suicidal thoughts. Causes of depression. Actually, there are some hypotheses. Number one, neurotropic hypothesis, monoamine hypothesis, and another one is neuroendocrine hypothesis. According to neurotropic hypothesis, the cause of depression is BDNF level. In the brain neuron, when the BDNF level is decreased, then depression starts. BDNF is a protein molecule that is encoded by BDNF gene. Here, BDNF means brain-derived neurotropic factor. The antidepressant drugs increase the level of BDNF in the brain neuron and thus prevent depression. According to monoamine hypothesis, the cause of depression is decreased brain level of dopamine, serotonin, and norepinephrine. Memorize this as DNS. Here, D stands for dopamine, N stands for norepinephrine, and S for serotonin. The antidepressant drugs increased the level of dopamine, serotonin, and norepinephrine in our brain neurons and thus prevent depression. Now, the treatment of depression. Oral antidepressant drugs. Another video on antidepressant drugs available on our channel. Check the above I button for this. And if you like this video, thumbs up this video and subscribe this channel.